Hello, I'm Dr. Jim Coyle, and in this tutorial for social work practice with individuals, I'm going to be talking about how behavioral and cognitive theory is used by social workers and how it comes together in cognitive behavioral therapy. Behaviorism proposes that behaviors observable and changeable, and that we learn behavior by conditioning. Classical conditioning, as demonstrated by Pavlov and his dog, shows that you can associate one stimulus with another. And operant conditioning, as Skinner showed with experiments with rats, shows that you can learn to behave through the use of reinforcement and punishment. Another aspect is modeling, in which you can learn by observing what others' behavior is. For example, if you see somebody get burned by touching an open flame, you generally don't have to touch the open flame yourself to learn the lesson that that's not such a good thing to do. And so you can learn by watching and seeing what other people are doing. So first thing to do here is to kind of consider, what have you heard about in the past? From your own past learning, from your past experiences, your observations of people, your work with clients, from your current reading. What makes sense to you about behaviorism? What's uncertain? Jot down some ideas about this so that you can use them in classroom discussions as well as in the role play that we're going to do in class. When you use behaviorism to help clients, you're assessing the function of observable behavior. You're looking at the antecedents, what triggers that behavior or cues that behavior. And notice that this triggers don't necessarily mean what causes the behavior. For example, and when you're using a behavioral approach, behavior therapy, in order to help a client, you don't really need to know any psychological mechanisms that may influence behavior, and you don't really even need to know what the previous conditioning was, since it's based upon the fact that you can do new conditioning and that behavior is changeable. So that when you look at the consequences, the responses to that behavior, you can also recognize, okay, so what do we do to make those consequences more adaptive, something that will be more helpful for the client. So you use the conditioning to learn a new behavior. Now, I found classical conditioning helpful when I was trying to help people who had different types of anxiety disorders and to associate the relaxation response that you can do behaviorally with a hierarchy of anxiety-provoking situations. For example, the smart shopper in the textbook is an example of this. One of the situations that I found it helpful in is a number of times I had people who had kind of an agoraphobic response about going outside and going in. One of the things that would tend to happen is doing their food shopping. And this was before the pandemic, so it wasn't the issues that we're related to in terms of being careful about that. But we would then be able to identify, okay, rate their anxiety on a scale of 1 to 10, and then begin to identify when is it something that's tolerable. Generally, we could get it down to about a 5. It was at least something tolerable, and then they could, progress. And then we would say, okay, when does anxiety start? And for many of them, it started by when they came into the parking lot with their car. And so we would start off by having them go to the parking lot, and then we would have them practice the relaxation exercises that we had practiced in the sessions. For example, the deep breathing exercises, as well as sometimes a kind of visualization of a relaxing place, a safe place for them. And each time they repeated that a number of times, and then that's it, and then they went back. So there's a repetition, and they go up the ladder in terms of the hierarchy. And they don't go to the next stop until they at least are able to get their anxiety level down to a 5 or below. And that was one of the ways that we could very helpfully use conditioning to help them with this. Now, operant conditioning can be really useful since it focuses on molding behavior through rewards and punishments. It can be very helpful when you're actually working with parents and who are having difficulty with children who are acting out or children aren't doing what they would like them to do. And there's another example in the textbook called Mama's Boy, which talks a little bit about that. There's a very interesting kind of parallel process that goes on here when I was using this with my clients. And that is that I could identify that many times the issue was that the parents weren't being consistent. They would tell me they've tried everything possible and nothing works. But what it tended to be is since they didn't know what to really stick with, they didn't really use a particular approach and stick with it so that their child could learn, because it requires repetition to learn. So seeing me as an expert, I was able to say, here are some things that a lot of research and a lot of books about child rearing and parenting suggest are really important to do. And then I would actually give them things to do. And this was having them give their children things to do. Well, so there's a parallel process there. And when they were successful, I would praise them. And I would talk to them about how other parents were able to use this so that there's a possible modeling effect here. And that was a helpful way so that I'm doing a similar type of things with parents as I'm trying to get the parents to do with the children. So that there is a modeling that goes on as well as a reinforcing. And one of the ways that I used to model with when I was using kind of relaxation exercises is when I would teach clients about deep breathing, I would do the deep breathing myself. And when I would teach them about visualizing, I talked to them about a visualization. I not only would talk to them about it, but I'd go through it and I would show by my body language that it was relaxing me and helping them to do something and look for the relaxation cues that were going on in their body at the time. And that's what we would do. So there's a modeling effect there too. The reinforcement is that looks really good. You're doing a good job. Practice this. And although I would try and ask the client, when will they practice it best? Certainly we could, the thing that I used to have them do most often is say, well, practice it 3 times a day, 5 to 10 minutes, and do it either before or after a meal, since we mostly eat 3 times a day, and that gives us a cue that, oh yes, we need to practice this at the time. And so that worked out fairly well for most of the clients. Now, in contrast, cognitive theory focuses on something a little bit different. It focuses on how thinking influences behavior. It comes theoretically from Piaget's stages of cognitive development, where Piaget said that infants tend to learn just by the sensory experiences that they have. And when they get a little bit older, that toddler stage, they begin to be able to learn by kind of recognizing that you can put words to represent things and that they could see them a little bit more in terms of a representative word or a phrase or some type of label, although they tended to be very egocentric and it wasn't difficult for them. It was difficult for them to see things from another person's perspective. As they got to be school age, they could begin to see a little bit more of cause and effect and how things were happening, although they tend to see things in terms of black and white and very concretely. It isn't until a person gets to pre-adolescent, adolescent stage that they're able to begin to think abstractly, and they get to that formal operational stage where they can look at hypotheticals and they can begin to be aware of morality and ethical situations. And generally speaking, in cognitive therapy, it tends to require that people are able to have this hypothetical thinking, this ability to think abstractly in order to use this approach. Aaron Beck was one of the earlier cognitive therapist, and he talked about the significant role of core beliefs or schemas and how that shapes your behavior. With clients, the example that I most often used was, if you believe that life sucks and then you die, that's going to be a very sad existence that you have. But if that's what you think, then everything tends to look negative to you, no matter what happens. And so then we would talk about kind of moving from that black and white thinking to what I called seeing the gray, that things could go a little bit differently, and there were things you can do to make things differently. In this particular cognitive theory or cognitive therapy mode, it was looking at the way we could change our thinking. Cognitive therapy tends to be based on an ABC model. And that is that there's a stimulus or event that happens, and we have a thought or belief that interprets that event, and that interpretation influences what our response is going to be. Now, for a quick example, let's say that somebody, a coworker or your boss at work says that you're a loser and you have no skills whatsoever. Well, how do you react to that? The first thing is consider 3 reasonable thoughts that you could use to interpret that. The first is that my boss must be having, or my coworker must be having, a bad day. If that's kind of the way that you see that, then what's going to happen is you're not going to personalize what they're saying, and you may give them a little bit of space or be more sympathetic toward them. On the other hand, if the thought goes to, well, oh gosh, I really am unsure about my skills and whether I can do a good job, you may then respond by saying, oh, this is evidence of this, and I may be fired, and your anxiety level may be increased. Finally, a third possible thinking mechanism is I don't let people push me around this way and say negative things without confronting them, and that I need to show them that I'm no pushover. Well, that tends to mean that your response is going to be angrier, and it's going to kind of be more aggressive, and that can have pros and cons. So the thing is that our thought mechanisms really do influence the kind of reaction that we're going to have, the response. Consider what you know in the past, from your past learning, from your experience with working with clients, from the current reading about cognitive theory and about cognitive therapy. What makes sense to you? What's uncertain for you? What really, questions do you have? And jot down those ideas, because that we can use in the in-class discussion as well as in the role plays. When you use cognitive theory to help clients, your role is generally an educator. You're going to start by talking about ABC, how stimulus kind of triggers thought mechanisms, and how the thought mechanisms are going to trigger your response. And you're coaching people to try different things, but keep in mind that you're collaborating. This is not about you telling the person what they should be thinking differently. It's about asking them to begin to discover different ways of thinking that's going to be helpful for them. And that's the purpose of the Socratic questioning. They lead the client to discover their own answers rather than suggesting the answer that you think that makes the most sense. So using that ABC model can help you to identify any cognitive distortions, maladaptive schemas, and then begin to propose cognitive restructuring. And I'm going to talk about that in a moment. Overall, you're helping the client develop problem-solving skills. How can they take a situation that they're in, recognize how their thinking influences it, recognizing what's going on behavior-wise in the response, and trying something different? Cognitive distortions are commonly used maladaptive thinking. So they're things that people tend to use over and over again. So examples may be catastrophizing, minimizing or maximizing, saying things like, oh, I'll never be able to do anything like this, or it'll always work out the same no matter what I do. Minimizing, maximizing. Another real common one is should statements. I should be able to do it this way, and I can't. Rather than talk to you and lecture about these, I'm going to suggest that you go to this website by Thrive Union about how to stop cognitive distortions. They do a much better job than I can of really kind of giving you a sense of what that is all about and some of the ways that you can intervene. So watch that video. It's a short video, but it's got a little cartoon in it. I think it's very accessible. Keep in mind that when you are helping a person with cognitive distortions, helpful questions include, what are you thinking? It's usually about a negative outcome. So you can say, well, what's the evidence for that negative outcome? And what are possible alternative outcomes? And what's the evidence for the alternative outcomes? Having them describe it rather than you come up with an alternative outcome, an alternative way of thinking that may be different. Help them discover it. And how do you practice that alternative thinking? Is helping them begin to say, okay, what makes sense? Because it has to make sense for them in order for it to work. So that's a real helpful way of kind of addressing cognitive distortions. Now, if we take cognitive therapy and behavioral therapy and we put them together, that's where we get cognitive behavioral therapy. It combines the two theories. So it considers how thinking influences your feelings and behaviors and how behaviors may be adaptive or maladaptive. Now, this makes a lot of practical sense, and I'm going to give an example in a moment, but it theoretically contradicts both theories, since the behavioral theory says it's conditioning that's key, and that's what we need to take a look at. And the cognitive part says, no, it's thinking that's key, and we have to look at changing thinking. Those are two different things, but one of the things is they do have similar ideas of change and treatment techniques, so they do tend to go together, because it's all about identifying what is maladaptive, what's not working, identifying an alternative, either thinking or behavior, and practicing it over and over again, and then using it in the situation to see about changes. And so they do fit together very well, practically speaking. So when you use cognitive behavioral therapy to help clients, you assess the problems in terms of observable behaviors. You look for what triggers the behavior, what are the antecedents, and primarily this is really helpful because then when you notice the trigger, you can manually put in the alternative thought or the alternative behavior instead of waiting for the automatic response, which is the negative, the cognitive distortion, or the highly anxious or angry or upset or whatever behavior, which is not really helping out. So knowing what the trigger is, you can say, wait, I can recognize that. I can put something in instead. And that begins to then change the consequence, the response. So it's assessing the behaviors that reinforce and the thinking that interpret the meaning. And so we're looking at both of those. So what I'm kind of doing when I'm working with clients about this is I am, so if I am seeing a person who is depressed and they are having a real difficult time getting out of bed in the morning and they're not enjoying things anymore, and particularly if they're thinking of suicide, then that may be something I need to address first. And ultimately what I want to do is to look at what is happening and then begin an educational approach. So there's a couple of things going on here. First of all, your thoughts, your thoughts that you can't feel any different. What's the evidence for that? How does that come across? What exactly is going through your mind? Get them to label that and to say, okay, what about alternative? What could also happen? What thinking would be the contrary to that? And help them begin to look at that. Now, if they can't identify it, I may give them a few things to look at. That there have been times in my life when I have been able to get through this. I've gotten through it in the past. There are times when I really do think that I have some strengths that I can use. I just have to remember to use them. So the thing is I may ask them what makes sense, and we try and get something that makes sense for them because I want an alternative thought that they can place instead, and they can begin having an internal argument about the thinking. Now, the behavior may be, okay, when you don't enjoy doing something, how can we identify things that you enjoyed in the past and really push yourself to do them, even though you don't think you're going to enjoy them? And many times I was able to help people know, okay, they enjoyed going out with friends in the past, but they just can't get themselves to do it. And I said, okay, well, if you go out with friends now, if you spend an hour there and it just isn't working out, you're not enjoying yourself, apologize and then leave. On the other hand, what could happen is being out with the friends does trigger some happy, some enjoyable feelings. And a lot of times what they would come back to me is I didn't want to go out, but I did. And it turned out okay. Well, that then becomes something that they can then change behaviorally. So they rehearse this and they do the activities, and it tends to change the consequence. One thing to keep in mind is this is using cognitive behavioral therapy for depression. When I evaluate depression, I always want to evaluate suicide or any other type of kind of problem thinking, hurting somebody else or something like that, because I may need to intervene more specifically about that. I also want to evaluate, should I be referring for a medication evaluation? If a person is not going to work, if they're not getting up in the morning, I may not be able to get them to do any of the behavioral changes because they're just too much. They may need a medication. And so that's part of it too. And CBT for depression is often in the research literature, it's also combined with a medication. Here's a couple of resources. CBT there's just all kinds of information out there. I think that these resources, which I will put in the comments for this video so that you can take a look at them and download these worksheets and this guide, I think that they can be really helpful for self-learning. There's also lots of continuing education for cognitive behavioral therapy. Okay, I'm going to ask you to take a look at this particular role play of Michelle. She's concerned about test anxiety, and this is a work situation where she has to take this test in order to get a promotion. But there's some very interesting parts about this. And so I want you to notice how the therapist uses Socratic questioning in order to help the client identify the negative thinking and the alternative thinking, and helping the client to plan behavior and reduce her anxiety. How did that happen? What did the therapist do in order to accomplish that? I also want you to take a look at, how is the therapist engaging? How does the therapist collect information, assess the situation, and identify a goal or intervention with the client? Jot down some notes as you're watching this, because this can help you as we talk about this in class, as well as give you some suggestions for what you can do in your role play when you're role playing cognitive behavioral therapy with your group in class. The benefits of cognitive behavioral therapy is that research tends to support its effectiveness. It's fairly easy to measure the change thinking and the change behavior, so that helps the research, and there's a lot of it. Specific treatment methods can be easily adapted to the client's unique needs, as well as clients tend to understand this, and they can evaluate their progress themselves. Some of the critiques is that cognitive distortions and positive cognitions are influenced by cultural factors, and you really do need to take that into consideration. And that's why you have to be careful about recommending specific cognitive alternatives. If you're working with a woman and from her cultural perspective, she feels that her husband is the head of the family and she has to follow his rules. Telling her that this is Canada and we don't operate that way, it may be true, but it may not fit for her. And so it may diminish her capability of making change. You may have to help her take a look at what's going to fit for her in her cultural milieu. When you use evidence-based techniques and you're saying, okay, here's what I do because this is what I learned in class and this is what I learned to do from the manuals and everything, sometimes you can focus your interventions on what you know is the right way to do it, rather than helping the client identify what's going to be most useful for them. So you have to be careful of that. Certainly, this is all present focused in cognitive behavioral therapy, and so it doesn't acknowledge the past if there's childhood trauma or experiences or unconscious responses that are really influencing this. generally speaking, what happens is you'll find that you're not having the kind of success with these approaches that you would expect. Then you may need to go back and evaluate a little bit more, and there may be other treatment. It's not necessarily that you eliminate the cognitive behavioral stuff. That still may be helpful, but there may be other treatment that needs to be added in to address some of these other issues. So to end this tutorial, ask yourself, what'd you learn from the reading that was assigned, from this tutorial, from your own experiences with clients? And again, as you jot down this is what we're going to talk about in class in order to make it hopefully more real for all of you. So I look forward to hearing about your ideas in the class.